Today, we're getting under the hood of women's health with Dr. Kieva, the co-founder and CEO of Fertitude, a digital platform that provides women with on-demand and stigma-free access to fertility and reproductive health products and services. Dr. Kieva will get under the hood of PCOS, Polycystic Ovarian Syndrome.
I was first diagnosed with PCOS. I don't remember the year, but it was at the point where we were ready to start a family. So this was, say, about 8 years ago. And we, of course, wanted to start a family. And I already suspected, based on my medical training, I know what the symptoms are. Usually you need like a scan, an ultrasound scan to confirm how the ovaries look and all of that. So we'd gone to the doctor to kind of understand what was going on, in addition to the fact that I wasn't seeing my periods and all the other things. And then it was confirmed. The journey to diagnosis. The thing about diagnosis like mine or like this is there's usually a spectrum. So I'm on the mild spectrum for women with PCOS, which is probably why I went quite a while without needing to do anything up to the point where I was ready to start a family. For some other people, they may have had to. So for me, I think I was living a normal life. Things that I noticed that changed, however, was my periods were irregular. And when they came with a vengeance. That's the way I would say it. They either came and they were like super heavy with like lots of clots. And I didn't have like pain as much, but it disrupted my day-to-day life at some point, because when you have like heavy periods and it's not like coming for just 3 days, it's coming for an extended period of time, that can be annoying. Periods are already annoying, in my opinion. So there was that. I'm realizing now, saying this, that I've always had acne as a teenager. Acne is one of the symptoms of PCOS, although the fact that someone has acne doesn't necessarily mean they have PCOS. So I had cystic acne in particular. And I remember my dad was always worried about this, because he would be like, oh, it's ruining my beauty and stuff. And it would be like so cystic. And my dad always thought it was because my hygiene wasn't great. So he would tell me to use like antibacterial soap. Oh, I love my dad, but his advice was off. So there was that. And I had like monthly cycles of acne that was like right here. And I hated it so much. But you know what? I'm grateful still, because I think people have like worse things that they've had to complain about. So for me, it was ruining my beauty with the acne, but it was also very painful, the cystic acne. There was the irregular periods that I couldn't plan, because I don't know when my period is coming. And then when it's coming and it's heavy and it's staying for like 2 weeks, 3 weeks sometimes. And then I go like a year without a period, or 6 months without a period. So I think those were the things for me. Emotionally speaking, there was just the underlying anxiety of, what does this mean, right? What does this mean for when I'm ready to start a family? I didn't want to have to go through that stigma, and but apart from that, I was doing fine. The impact of PCOS on my life, to be very honest, I think that I'm doing well. I know that I'm doing well. I don't think, mostly because of my medical training. So just knowing what to expect sometimes can reduce significantly the impact that something has in terms of like throwing you off balance. But if I were to mention some of the things that have upset that balance or that equilibrium, physically, for instance, I mentioned the acne. It's not pretty, right? So for instance, I may have a shoot coming up and acne pops up. And it's not the blackhead or the tiny kind. It's the ones that are like huge and cystic and look very odd sitting on your face. And it's like when people see you coming, they see the acne before they see you. So I think just like in terms of like cosmetic, and cosmetic is not inferior, please, there is also my periods being unpredictable. Sometimes I don't get a period for like 6 months. And when it comes, like I said, with a vengeance. So now I'm having these heavy periods, which means that I don't want to be caught unawares without like not having what I need for the period. I'm thinking about this when I'm choosing what to wear and all of that stuff. So that's a little annoying. Not a little, it's very annoying. And so the flip side to this, to be honest, is the positive impact that PCOS has had on my daily life. I remember being happy to miss my periods. So there's that as well. It's not all negative. It's not all negative. I'm like, you know what, period, be gone. I'll be okay without you because I don't even like having periods anyway. From the emotional aspect, so classic PCOS symptoms, right? Because of the hormonal imbalance, we expect to see like the mood swings, the extreme mood swings. But I don't think I've had that as much. I've mostly just had the anxiety around what this means for my fertility. Because I'm from a part of the world where there's a lot of stigma just around, oh, we call them the womb watchers, the people who are waiting for you to have a baby. And I just don't want to have to deal with any of that. So I was like, okay, I'm happy to not have my periods, but now am I going to have to deal with like waiting a while before having a kid and starting a family? So I think that's just the emotional side. And again, for that, I feel like I've dealt with that well. And maybe we'll delve into that a little later, like talk about that more. But yeah, that's how I'm dealing with the day-to-day of PCOS diagnosis. Yes. The symptoms that I've found the most challenging to manage, I would say, would be the acne, the unexplained weight gain, and the fertility aspect of it. So for the acne, I think for the most part, I didn't even realize that it had anything to do with hormones or it had anything to do with PCOS, let me say. Because we're told puberty, acne, it's part of, the journey to becoming a woman. And you might notice acne, you may have breakouts sometimes. But I think for me, I kept having like this particular same type of acne, they call it the cystic acne, on the same spot, literally like here, right here, and right here. And it leaves a scar and affects like the way you look or the way you want to look. And so I didn't like that at all. I've been able to find, the cure in quotes for that. And I'm doing fine now. But I hated it for the longest period. For the unexplained weight gain, I really like to eat. But I mean, there was a point in my life where I had not necessarily changed my eating habits. And I'm like, why am I gaining so much weight if I've not changed my eating habits? I think right now I've realized that the sedentary lifestyle just does not favor me. So I made my peace with that. Yeah, so even with trying to do everything though, I find that, I'm managing for like diet, managing for activity, like being more active, but this weight is still taking like so much time to go. Maybe that has to do with age as well, right? But those are just some of the things that I find the most challenging. For the fertility aspect, I would say that for this in particular, I've not necessarily seen this as challenging from the PCOS angle, because there are other reasons why we decided to wait to start a family. Some like there's the genetic reasons, there's the financial reasons. But perhaps if I did not have PCOS, maybe I would have gotten pregnant, right? And we would have worked out all the other things like the finances and the genetics, maybe. So these are the things that I think when something is out of your control, you find it challenging, right? So these are the things that were not really out of my control. I think what has evolved about it is you start to get more education about the situation, and then you know what to do and you know how to handle it better. And I think that's what has changed. Understanding it, seeing this symptom for what it is, and then saying, okay, now I know how to manage this thing. And so I feel more in control of the symptom. I started to notice the most significant change when I started supplementing my diet with inner store supplements. This is not an ad by any shape, form, or size, but the one I found most effective is Ovasitol by Theralogics. And it came with a lot of good reviews. I'm a marketer, so I know that it may have also been PR, but it was PR that saved my life. So, okay, I'll take it. However, if I have to give context, I also started using this supplement at a point in my life where I got my mindset right. So maybe it wasn't the supplement, and maybe it was just my mindset. But I also know that there have been times where I got my mindset right and I wasn't supplementing and I wasn't seeing results. So rumor on the streets is that with PCOS, it can be hard to lose weight. I don't really know whether that's true because I just take accountability. When I find it hard to lose weight, I just tell myself, Kiva, it's because you're not doing something right. Rather than blame it on the PCOS, I blame it on myself. So I don't know, maybe that's what it is. But the things that have worked for me have been like combining all of these things. So taking my mindset, when my mindset is not right, nothing works because I have to be like, Kiva, first of all, you need to watch your diet and be very careful about what you're eating. You need to log your meals so that you're actually able to keep track of what you're eating, right? Then you also need to be active. So I try to do like 10 steps, 10,000 steps, or, sometimes 10,000 steps might not be realistic if I'm working hard that day. So I'm like, okay, at the very minimum, 6,000 steps. So if I take a 30-minute walk just around like where I live, that usually like does it for me. So combining that with eating right and then supplementing is what I find like has worked best for me. Now, eating right is also something that annoyed me a lot whenever I spoke to, the doctors, because it's like, you're not telling me exactly what. So it took a bit of experimenting for me. I found that what I was eating wasn't necessarily the problem. Well, maybe it was, and I'll talk about that shortly, but maybe it was the way that the food was being prepared. So using like certain ingredients excessively, but also eliminating some things from my diet. Now, another annoying thing about PCOS is people tell you to eliminate almost all the things. And I find that does not work for me because I'm not able to be consistent. But there are just some things that causes inflammation for my body that I realized affected my gut health. So I realized I was lactose intolerant. And, at the point in my life where I started noticing irregular periods, I also noticed that I started having this stomach pain whenever I took milk, but I didn't pay attention to it. I didn't even think that lactose intolerance was a thing until we took that course in med school. And I was like, okay, maybe. But again, I did not think that it was that serious for it to be maybe the cause or the trigger for my PCOS symptoms. I do think that our gut health has a lot to do with a lot of these things, our hormones and whatnot. So eliminating lactose or certain dairy, because I take some things, I take Greek yogurt and I'm fine. I take milk and I'm not fine. So certain kinds of dairy. So I had to like monitor. So I just had to be more observant. And that's why I said getting my mind right. I think getting my mind right and then now going on to apply that to all the things that I was ingesting and how active I was what did it for me. If I did one of those things in isolation, it didn't help as much. The diet, the mind, the diet, the activity, and then the supplements. Those things in combination is what works for me. Also, I have to add, because I mentioned that I was having acne, I started using, at some point when I was feeling very comfortable in my life and I was ready to splurge on going to see the dermatologist, which should not be a luxury. But for me, at that point in my life, it was. I did like this skin routine and I realized that all of a sudden my skin cleared up. My face cleared up. So I kind of stopped even though I've stopped going to see the skin doctor, I retained some of the things. I took a peep from the doctor's notes and just retained some of those things. So there's a particular face wash I use I use it every morning before I brush my mouth, and then I wash it off when I go in the shower. And oh my God, no more acne. I'm like, why didn't nobody tell me? Like, I would have done this like as a teenager or like in my university years, and I would have felt a lot better about my skin, right? So those are some of the things that I do. All of the things I do, actually. I have felt supported by my family throughout this journey, by my friends, to the friends that by my friends, by my healthcare providers, not as much, and I will explain why. So let me start with my partner, my husband. I thank God I chose right. So there is a little bit of, there's some credit that goes to my partner, him being as supportive, because I know I'm on Twitter a lot and we see the gender wars of how that men aren't as supportive and patriarchy must die and all of that stuff. And I'm like, okay, I was smart enough to choose the right partner who did not have any of those toxic traits. We've had conversations around just certain things around like how a man thinks about when your partner is navigating like a fertility situation, where my partner may have said things that I did not agree with, and we had conversations about it. So I won't say that, oh, my husband, like, he came out in spanking white, knight in shining armor, no flaw at all. No. But we have an atmosphere in our relationship where we can have conversations. So I feel 200% supported by my husband, just navigating like my entire health situation. Does it help that he's also a doctor? Maybe. But I do feel supported. For my friends, I had the conversation with them before things got awkward, because people always wonder, oh, what's wrong, what's not wrong. Why aren't you pregnant yet? I've been married for 7+ years, right? And it's like people are whispering. And so I just did everybody the honors and address the elephant in the room. Hey, in case you've been wondering, you should know. Okay, so that's what I did. And I think that put them on their toes, right? Because now you have to be a good friend, okay? And now you have to check on me occasionally. When I had the conversation, some of them did ask, oh, is there any way we can stop? I'm like, no, really, I'm fine. I'm just telling you this so you're not tiptoeing around the situation. But of course, now that you're asking, it would be nice for you to check in with me every now and then. But I am fine. For my parents, it was a tougher conversation because they're more traditional. And where I'm from, the traditional African parents, they feel a little bit of trepidation or fear. Just, they don't want their daughter to be labeled as barren or the one who has like this health challenge. And so I think for that, I had to put my foot down with them to say, hey, we're not going to be wondering what people think, okay? We're just not going to do that. But what I also did was I educated them on my situation, right? Like I kind of sat them down like doctor to patient to explain what my health situation meant to them. And you guys, you don't need to worry. I'm fine. Like, your daughter is doing well. I also did a bit of reminding them that I'm doing well in my life, and this one thing doesn't change that. Just because as traditional humans, I get that a lot of where my parents were coming from was out of concern. But I also understood that some of it was coming from a bit of the traditional shame of what will people say. So I had to tell them, on this society part, I'm going to put my foot down. If you're going to be that way, that's on you. I don't care as much what people think. I'm dealing with that. So it would help me if you don't bring that to my table, right? It was tough. I fought with my dad at some point before he could get the message. I literally didn't speak to him for 6 months so he could get the message. So now my dad tells people that there are certain things he can't try with me because he knows that I'm going to like push back. So I'm happy with that. Healthcare providers, the support, right now I feel supported by my current, the clinic that I go to. And that's the clinic where, we're going to be getting our procedure done, the IVF procedure done when we're ready for it. But it's one of the really high-end clinics, right? However, for all the times where I just went into like a regular hospital, the support that you get, it's more of, first of all, as a young girl, there is you don't really need to worry. When you're ready, if you want to see your period, we can just put you on birth control and you'll see your period, but just come back when you're ready to start a family, right? And that's not support, in my opinion. We need to treat women as whole, not just based off of having a baby. Because it's like, oh, you know what? There's this situation, we don't really understand it. But the only one thing we find important is motherhood, right? So that baby, we know everybody wants a baby. So when you want a baby, come back and we'll try to figure out what's wrong and try to help you figure that out. But we're not as worried about all the other things, right? So the future that I hope for and desire is one where when a young girl presents at the clinic and PCOS is suspected, the management protocol is such that she's co-managed with all the other experts that she needs to see. And you know what? In the textbooks, that's what we're taught. So we say it's multidisciplinary management, but we don't really act it out in reality. I had acne for the longest while. Like nobody told me go speak to the dermatologist. The dermatologist could have recommended the face wash that I now use to me years ago, right? And I wouldn't have come up down with like maybe the scars that I now have. And you know what? I'm talking about physical scars, but they're also like scars internally, right? And just so, yeah, I do feel supported now. And even the support, to be honest, it's like 70%, to be honest. What I do is I try to educate my healthcare providers. So sometimes I tell them the things I'm doing. And the current health provider I use, they ask me questions. They're like, oh, they write things down and they're like, oh, we're going to do our research. Thank you for sharing that with us. Maybe that might help us serve our other patients better. So yeah, that's where I'm at. I feel supported, but in cases where I don't feel supported enough, I advocate for myself. And I hope that also, makes things easier for the next woman coming after me. My perspective on body image, I'm learning to love my plus size self because I realized that when I was 2 sizes smaller, I thought I was big. It's wild. So I'm looking at my pictures from 2 years ago when I was a lot slimmer than I am now. And I realized I wasn't comfortable then. And I look at my pictures from 4 years ago and I realized I wasn't comfortable then. And right now I'm looking at those pictures and I'm like, girl, you were hot. Like you looked so good. So my realization right now with body image is it's a bit of an Oliver Twist situation where you keep wanting more. Girl, you look good. You look stunning. So you need to like live in this moment and enjoy this moment so that when you look back in the pictures, you're not regretting that you did not enjoy the moment you were living in, right? It's easier said than done though. So I really don't know what the solution is just for the world in general, fixing the body image issues. Maybe representation is something that helps or is something that I'm finding to help. And maybe more people speaking on the issue. On fertility, I have a radical perspective that I'm still, sometimes when your perspective on a particular issue shifts, you kind of want to be careful before voicing it out because people who knew the old you may not be able to relate with the new you that has evolved. Right now, when it comes to fertility, I realize that I'm comfortable with not having kids that have come through my own vagina. I am. And at first, I thought it was a coping mechanism, because sometimes when we want something, I had this childhood dream. I want to be a mom. We all grew up, oh, I want to get married. I want to wear the white gown and I want to have kids. And so sometimes when we want something, but we're not able to get it, we cope by saying we don't want it anymore. So at some point, I was asking myself, Kieva, is this a coping mechanism? Are you trying to cope with the fact that it's taking you longer than it would naturally take to start a family by now saying you don't want one? And maybe at first, I had to address that, say, Kieva, you're going to hold on to your dream, okay? Because you're going to start a family and it will happen however so. But this is different because just speaking to people and educating myself on the subject matter, I'm upset at the fact that as young girls, we inherit this fairy tale perspective of what completes us. And that upsets me. That's the singular reason why I feel this way. So right now, we can't even separate whether we truly want these things or that's the only thing we've been trained to believe will make us complete. And so that's my perspective. The internet. literally. Like, I don't even need to overflog this one. It's been the internet. I, however, would have to credit my medical training because I was able to use that as a filter. Sometimes you see information on the internet and you don't know what to make of it. But when I saw information that was right, I could spot it because I'm like, this makes sense because we were taught the physiology, we were taught like the way this works. So, oh yes, this makes sense. Like, why didn't you say that? Yeah. So I'll say the internet. The internet plus my medical training is what has helped me the most. If you suspect that you may have PCOS and you haven't gotten the diagnosis yet, ignorance is not bliss, okay? I get that you're scared. And sometimes we don't want to put a label to things because it's easier. Like, I don't want to know. Please go speak to a doctor and go get tested. Because at that point, you now are able to get on that journey of accepting and, getting or managing your health better. You don't want to wait until it's too late. Now, for the woman who you just got recently diagnosed and you're worried, you're feeling overwhelmed, I would like to remind you that getting bad news is kind of a part of life, right? As adults, it's part of adulting, I would say. It's something that we have to embrace. Sorry, but it's the truth. You have to embrace it. So we go through like the stages of grief where at first we're in denial and then we get like really sad, we cry, we throw a fit and all of that. Go through all the stages, right? Do what you need to do. But at the end of the day, you would need to rise up and figure out what you need to do, right, to manage your symptoms, right? So first, yes, I'm not going to invalidate however you feel. That's okay. But once you've gone through all of those motions, then you need to rise up and do what your body needs. So either you're getting the help you need from your doctor, right? Or, like me, you might do some research. The good thing is that right now on the internet, you will find coaches and just like people who have like a body of work that they put together to help you find what you need, right? That's one of the reasons why Fertitude exists, for example. We're trying to make it easy for women to find the answers they need. So do your research as well. But if I were to make it easy for you, I would say keep in mind that there are like kind of 4 pillars around which managing the overwhelm you feel revolve. The first is mind. And I think the mind really will help you solve the overwhelm that you feel. It all starts from the mind. So if it means that you have to like go spiritual, if you're a spiritual person, or you need to find some activities that can help you, or you need to find community like support that can help you do that. But if you find all of that emotional support and you do not find the physical support, then that may amount to nothing. So you also need to, find what works for you in terms of your diet, in terms of your activity, and in terms of supplementation if you need that. And it's all of those things. So just get ready because it's a marathon and not a sprint, but it's not a life sentence. So you will do well. So please remember that, not a life sentence at all, and you'll be okay.